Welcome everyone to Sensory Processing Disorder and Is It Sensory or Is It Behaviors webinar on Wednesday, January 18th at 6:30. Guest presenter Allison Cole from Good Shepherd. All right, our disclaimer is the ARC of Lehigh, Northampton County's Advocacy Department does not employ lawyers nor provide legal advice. This training or any others provided by the ARC Advocacy Department does not constitute or imply the endorsement, recommendations, or favoring of the providing party or any employees or contractors acting on its behalf. This webinar is being provided for educational and informative purposes only. Now it's my pleasure to introduce our guest presenter, Allison Cole. Allison Cole is an occupational therapist and has worked at Good Shepherd for 10 years. Her background is primarily with the neurodiverse population. She is the occupational lead for the Bridges Adult Developmental Program. In addition, she has a background in neurovision rehab and is the co-lead of the Good Shepherd Assistive Tech Program. Thank you for your time this evening, and the Zoom is yours.
All right, hi guys. I'm just gonna get started by sharing my screen and getting the presentation up and running. All right, so like she said, I am an occupational therapist at Good Shepherd Rehab. But I work primarily in our neuro department, and me and one of my coworkers, I think it was around 2015 or 2016, started noticing a lot of referrals for individuals with developmental disorders who were being referred to therapy, maybe in their 30s, 40s, and had gone many, many years without services. So we had decided that, just because someone turns 18 doesn't mean that suddenly their developmental disorder just disappears and they no longer need therapies, that we wanted to start an adult program for individuals with developmental disorders. So we began our Bridges program. It encompasses occupational therapy, physical therapy, speech therapy. We also have a care manager who is very well versed on different resources in the Valley for individuals with developmental, or maybe they need financial assistance and things like that. We also have physiatrists that we will refer patients to periodically, as well as nutrition. So it's really an all-encompassing program to help individuals transition kind of from that school-based model into adulthood. So what I'm going to talk to you guys about today is sensory integration theory. Is it sensory or is it behavior? A lot of times I get referrals for individuals who are having different behaviors that might be impeding their function during their daily tasks, whether they're in school, whether they're in a work program or things like that. And one of the things to kind of determine is sometimes these behaviors can be stemming from a sensory need, and sometimes they might just be behaviors. So it's kind of important to kind of see what a person might be experiencing to see, okay, is this person having a specific behavior because their sensory needs aren't being met, versus someone needing maybe behavioral therapy services to address specific behaviors. So I'm going to start by explaining what is sensory processing. So sensory processing refers to the way the nervous system receives messages from the senses and turns it into an appropriate motor and behavioral response. Now, what I'm going to do is I'm going to keep kind of going in and out of my presentation here because I have various clips. So I'm going to start with this one.
Some kids aren't very coordinated. Some see food as a pile of toxic goo that hurts their mouth and jangles their taste buds. School might be a mysterious place where things don't make much sense. If this sounds like you, you may have sensory processing disorder, and we're going to explain it here. Your body has 7 senses: vision in your eyes, hearing in your ears, touch in your skin, taste in your mouth, and smell in your nose. And you have 2 movement senses: your muscles and your sense of balance. In sensory processing disorder, these senses don't communicate right with your brain. Think of the nerves connecting your brain and senses as a set of roads. Those roads should be smooth superhighways so that the senses and brain can communicate fast. If you have sensory processing disorder, then some of your roads are bumpy and rough. You can also think of the senses as having a broken volume control. If the volume is too high, you will feel your senses too strongly. If the volume is too low, you won't feel sensation at all. In fact, you'll want more. Some kids overcome these problems as they grow older. Others need help. Help is usually occupational therapy, and it's fun. Occupational therapy helps build up the connections between your senses and your brain. The more you do, the stronger and smoother they get, kind of like paving those roads. After a while, you'll learn to slow down and sit still, to pay attention, to eat, to be comfortable and happy doing movement. It takes time. There's homework, too. But the more you work at it, the better it gets.
So information comes in through various senses, and then sensory information is then interpreted by the brain, and the brain puts out a response to that information. So a person who has sensory processing disorder can find it difficult to process and act upon information received through the senses. This can create challenges in performing countless everyday tasks. You might see this in motor clumsiness, behavioral problems, anxiety, depression, school failure, and many other problems that may impact those who do not receive effective treatment. So what happens when there is a breakdown in the process of sensory processing? There's a mismatch in information. You can be either under or overreactive to stimuli in the environment or others. There's a breakdown in communication, and this can result in behavior sometimes. So I'm going to load up another video for you guys that explains it pretty good.
Two items out, because one of the biggest questions that we've been hearing with our families that come in for intake is, you know, I've gone to this doctor, and I've been tested by this person and this person, and the issue turns out to be a sensory issue. And these parents are so frustrated because they feel like they've been on a 2-year mission to find the answer for something that was actually quite simple. Sensory is, it's a specialized area for occupational therapy, but sensory problems can manifest themselves, and usually do manifest themselves, in problematic behaviors. It's like anything. If you're uncomfortable in your own body or not feeling well, that's going to come out in behavior. And that's typically the way small children are. Even as babies, we know fussy babies are fussy for a reason. Fussy children and children that aren't compliant for a reason. So there's usually a reason to everything. And sometimes that reason can be sensory. Now, we know all children, typically developing children, have times where their behavior isn't good. That's normal. However, our sensory kids have extraordinary problems with this all the time. So that's the first thing you need to look at. And believe me, if this is an issue, you know it, because your life is, you're managing your life and your schedule around your child. So whenever you feel like that's going on more than the child being able to join along with your schedule, that's usually a strong indication that there's some issues. And sometimes a child will go through a brief period in their development where things are difficult, but our sensory kids are like this for a long time. It's not something that goes away. So I brought out a few things. This is a poster we keep in our waiting room, and I really like it because it indicates some sensory areas you can have. A lot of our sensory kids have trouble with their hair being brushed and their hair being washed. And remember, I said these are long-term issues. This is not an issue that occurs for 6 months. A lot of them are sensitive to light. Some of them are very sensitive to sounds. They don't like to have their teeth brushed. They don't want to get their hair cut. They don't want to get their nails clipped. Some of them don't even want to bathe. They're also very sensitive to clothing textures. That's another thing we see with our sensory kids. So this is a nice little resource we developed that's a very quick resource. We also have a checklist that we oftentimes give to our families. And this is done developmentally. So we have questions for infant and toddler. We have questions for the preschool child. We also have questions for the school-age child. And we have questions for the adult adolescent. A couple of examples for the infant toddler are, my infant toddler is extremely irritable when I dress him or her, seems to be uncomfortable in clothes. Another one is, my infant toddler resists cuddling, arches back away from the person holding him. That's just a couple. The preschool one, my child is unaware of being touched, bumps and bumped unless done with extreme force or intensity. My child seems unsure of how to move his or her body in space and is clumsy and awkward, or my child is in constant motion. On our school age checklist, and like I said, slow to learn a new activity, my child craves roughhousing or tackling. And in the adult adolescent, I'm oversensitive to environmental stimulation, or I feel very lethargic and slow in starting my day. So these are just a few indicators for you to look at and consider. And please go to our website, because we have further information about that, or you're welcome to come in and or give us a call and chat about it. But
so those are, she gave a couple examples of different things that might indicate that someone is having sensory issues. One of the things that I like to mention a lot of times too is that everybody has sensory issues. We all kind of have our own ways of regulating ourselves throughout our day in order to kind of manage our emotions. I know myself, I'm one of those weird ones that I thrive better in loud environments. When I was in college, I always had the TV on and played music when all my friends were over at the library being quiet. I'm of that millennial age group that if I do not have a tank top underneath of every outfit that I wear, I feel uncomfortable because I don't have the compression. So we all kind of do things throughout our day to manage our sensory needs. One of the things that I find a lot of times when I'm getting parents of adult children who may be on the autism spectrum that have sensory difficulties, they really focus on the stimming behaviors and how do I stop the stimming behaviors? How do I make the stimming behaviors go away? Well, the thing, you don't. And the stimming behaviors are very important, because what that individual is doing, depending on how they might be stimming, is they're actually regulating their emotions. They might be rocking back and forth because they're getting some vestibular and proprioceptive input, and that is allowing them to feel grounded in their environment, to feel comfortable. So the second you tell that person stop rocking, you now have put them into like a state of anxiety and they don't know what to do with themselves. And that is typically where we start to see behaviors, is when you're not regulating someone's sensory needs appropriately, they don't have anywhere to go with their extra energy or feelings. It ends up going into some kind of behavior. So it's always important to kind of look through what behaviors you might be seeing and kind of teasing out, what is this individual doing this because they are seeking some kind of sensation to calm themselves down in a stressful situation? Are they so overly excited they can't contain themselves that this is what their output is? I've worked with individuals who, when they're feeling stressed or upset, they'll ram their bodies into things. They might ram into the wall, they might slam on a chair. Again, it's getting that deep proprioception to try to calm themselves. When there's an issue, though, is when sometimes some of these self-stimming or sensory needs become unsafe. That's kind of when we have to, as OTs, break down and see, okay, they're doing this type of behavior. What sensation are they seeking? Is there a way that we can replace that behavior with something else that is either safer or more appropriate, so that they are still getting the input they need to feel regulated and feel comfortable? The one thing to realize is that sensory processing disorder is not a standalone diagnosis in the DSM-5, but it is a component and diagnostic criterion for autism spectrum disorder. So a person could be either hyper or hypoactive to sensory input, or have unusual interest in sensory aspects of the environment. Example, they might be indifferent to pain or temperature, have adverse response to specific sounds or textures, engage in excessive smelling or touching of objects, visual fascination with lights or movement. I like this picture because it kind of breaks down sensory integration disorder can be a part of a bunch of different diagnoses. It's not just autism spectrum disorder. Individuals who have ADHD, ODD, learning difficulties, autism spectrum, anxiety, Tourette's, OCD, developmental disorders, individuals who are gifted, auditory processing, all of these have elements of sensory processing. And as mentioned earlier, I work in our neurovision program, and one of the things we see a lot of times is individuals who've had brain injuries or concussions also to have some difficulties with sensory processing. So it's a part of a bunch of different diagnoses, and I think sometimes it gets under addressed or underlooked at, that sometimes just looking at some of the sensory issues can kind of make things a little bit better for an individual. So how do we treat sensory processing disorder? So in the occupational therapy world, we use sensory integration therapy. This is really most commonly used in a pediatric therapy setting. It was developed by Jane Ayers. She kind of was the pioneer for sensory integration for OTs. So she was an occupational therapist, an educational psychologist, and also a neuroscientist. The way she describes sensory processing disorder is more of like a traffic jam that prevents certain parts of the brain from receiving information needed to interpret sensory information correctly. So the theoretical base for it is the brain's ability to organize sensory information received from the body and environment and then produce an adaptive response. Another model that's often looked at in occupational therapy is called Dunn's sensory processing model. In our adult developmental program, a lot of times when we are assessing sensory, we use Dunn's model, which is the sensory profile. And it breaks it down into 4 different subcategories. So an individual, usually when we're using this assessment, it's a self-assessment that's given to either the individual themselves or a family member or close caregiver. And they answer a questionnaire, and then that goes through and kind of looks at different areas of sensory and see, does the person have either a high or low response to that? And then it, based on how it's scored, we'll put them into a subcategory. So individuals can be sensory seeking, sensory avoiding, sensory sensitive, or have low registration. This picture here just kind of shows different aspects of it. So what whether their threshold will be high, meaning that they habituate to something, versus whether it's low, meaning that they need sensitization. There's also subtypes of sensory integrative dysfunction. So visual perceptual deficits, somatosensory deficits, which is kind of your body's, how your body feels things, bilateral integration and sequencing deficits. So meaning being able to use both sides of your body for something. So using 2 hands during a task, you might notice someone has a strong preference to using their dominant hand and will not know how to incorporate the other one. And then sequencing, meaning being able to put things in specific order. And then also dyspraxia. In adults, sensory integration deficits might coexist with other health conditions such as chronic mental illness, pervasive developmental disorders, acquired brain injuries, or even in our elderly population with dementia. This is just another diagram I put into the presentation. You can look through it very briefly. It kind of breaks down those different areas that I just described and kind of defines what it is. So a sensory modulation disorder is a problem with regulating responses to sensory inputs, resulting in withdrawal or strong negative response to sensation. So these are the people that are distracted by noise, oversensitive to sound, might dislike their nails or hair being cut, doesn't like different textures of clothing, doesn't like seams in socks, difficulty with staying or falling asleep, reacts defensively to taste and texture, and distracted by visual stimuli. Sensory discrimination disorder is a problem recognizing and interpreting differences in similarities and qualities of stimuli. So these are like rough and tumble guys. They like to jump on beds, they bump into stuff, they crash into stuff, they grasp things too tightly, they push down on their paper too hard. They drop things. They like to stick things in their mouth, bite on things, chew on things. They love moving and spinning. They might be afraid of heights, swings, or slides, and they also typically have poor balance. Postural ocular disorder is a problem with control of posture or quality of movement. This is seen in low muscle tone or joint instability, and they might have poor functional use of their vision. It is often seen with vestibular and proprioceptive problems as well. So these are, I describe them as the couch potatoes. They like to loaf a little bit. They're weaker than other children. They fatigue easily. They slump, they don't sit up, they're kind of have the flex forward posture. They don't make eye contact, they don't track very well. They fall and tumble frequently. They feel heavier, like kind of like dead weight when you try to lift them, and they have flat feet. Dyspraxia is a problem with planning, sequencing, and executing unfamiliar actions, resulting in awkward and poorly coordinated motor skills. It's usually seen with difficulty doing new activities or for something that's not done very often. So they have problems with daily tasks like dressing or using utensils. They might eat pretty sloppy, difficulty following multi-step directions. They like routine. They don't like doing new things. They have poor handwriting, and they dislike or they're reluctant to play in sports. So I know growing up, most of us were taught that we have 5 senses. That is incorrect. They describe 7, and they've actually recently added a new one called interoception. So you have your touch. Vestibular is kind of your body's awareness of where you are in space. It contributes to our balance. Proprioceptive is the information that our joints take in and let our brain know kind of where we are in space. You have visual, you have auditory, smell, taste, and like I said, interoception is a newer sense. And this is a sense that's responsible for detecting internal regulation responses, such as respiration, hunger, heart rate, and need for having to go to the bathroom. So an individual can be seeking, sensitive, or avoidant or any combination of any of the senses. So what I want to do is go through each sensation and kind of break down into what might be either alerting or calming with that sensation. So when we think of tactile, an alerting sense for that would be rubbing, patting, or putting like a cold object on someone. Calming is going to be that deep pressure, hugging, and self-massage. Vestibular detects movement and gravitational pull. It provides information regarding the position of our head in space and acceleration and deceleration of movement. So if you're using vestibular input, if you're trying to get an alertive response from someone, you're going to use circular or rotational movement. So this would be like spinning on stools. I work with so many individuals in our vision program who are on the spectrum, and watching them spin on stools literally makes me want to vomit. I don't know how they do it, but they crave that. And I know a lot of times too, individuals will like being on roller coasters and going on rides. That sense, their body craves it and actually kind of perks them up and wakes them up a little bit. When we're thinking of someone who needs a lot of vestibular input and we want to calm them down, we're going to think about slow linear movement. So having them go on a swing, rock on a rocking chair, things like that will help kind of slowly calm that person down versus spinning, which is going to raise their arousal levels. So proprioception is one that I see most often. And a lot of times people who have difficulties with proprioception have a hard time paying attention. And the more proprioception they get, or like doing proprioception before something they have to attend to, we usually find that their attention's a little bit better. So proprioception provides a sense of body awareness. It helps us understand how much force we are using and whether we need to use more or less force in order to successfully complete a task. So for someone who needs proprioception input, a calming way to provide this might be using joint compressions, using a brushing protocol. These are the kids or individuals I work with that I will have parents offer hugs, or one of the things I do a lot of times is I'll have the individual lay down on a therapy mat, and I'll take one of the big yoga balls and I'll just rub it over their back, their legs, their arms, and push into it to give them some deep pressure. Alerting is going to be more fast-paced, quick changes, jarring, jerking, starts or stops. So this is going to be more like jumping on a trampoline, doing jumping jacks, type of agility type drills and obstacle courses and things like that. Another way that a lot of times we'll use heavy work is, or proprioception is heavy work. So the idea of having someone carry something or push something, moving furniture. I've had people weight down backpacks and have someone carry a backpack so that they're getting constant pressure on their shoulders. I'm going to play a quick YouTube video that actually is an individual who is an adult with autism who describes proprioception and how he uses it and it makes him feel. And I think it's just a good perspective to kind of understand what it is.
Hello, Autistic Genius here. Welcome to another video. Today I'm talking a bit about me. I've talked about a lot of sensory stuff in the past, like how these sensory things can affect people with autism. But I think I should really maybe tell you how it affects me, because I think maybe you'll see something I say and go, that's why my son does this. Oh, that's why my daughter does this. That's why my friend does this. That's why people do this. So hopefully it will clarify maybe some potentially weird or odd looking things that people may do. Today I'm talking about how I'm hypersensitive to one sense, and that sense is proprioception. Proprioception is your body awareness. Where is proprioception found? Well, it's found in your joints. One of the things that I do a lot, which is really yuck. Well, basically what I do is another thing that I do, this is something that actually was really funny. This is where the idea of the video came from. It was a spark in conversation. When I was talking to somebody, I found myself doing this. If I'm walking down the street, I may do some weird movements, to kind of incorporate them into stretches. Like I remember once when I was at a bus stop, I was waiting for a bus, and then suddenly I found myself doing this. But I have to do these things because it feels nice, and for some people it may be like, oh. For me it's like, oh, this is nice. But I have to do it because it's really nice feeling, and it gives me comfort. It makes me feel good, makes me feel happy, and it also is good for stress. Like I'm really stressed. Oh, I'm really angry, so I'm going to push my joints so far apart they snap. That's all I got time for today. Thank you so much for tuning in. Thank you so much for watching. Thanks for keeping up with the page while I've been away. It's been really appreciated. And keeping up with YouTube and keeping up with Twitter and the new Periscope, which is just
So like I said, I like his point of view because you can kind of see from someone who experiences and verbally can say like how nice that makes them feel. He's going again. Hold on. Let me transition back to this. And like I said earlier, I feel like there's so many of us who do sensory things throughout our day and don't even realize it. My brother-in-law, I always share this story because my brother-in-law is like near genius computer guy. He writes bank code for a big bank. And the thing that's interesting is that while he is writing, he'll be in meetings with like Barclay, who is he? One of his big, I can't think of I don't know. I'm not gonna think of the name, but they're a big company in New York. He'll be on a meeting with them, and the whole time that he is on the meeting doing all this big bank transaction, and like he is literally bouncing on a therapy ball in his office on a conference call. And that is what he does to focus. So like we all kind of do our own things and without realizing it, but we have the ability to self-regulate. And sometimes it's kind of seeing those things in individuals that we work with and understanding what they might be doing to self-regulate, and then helping provide them with the tools they need in order to self-regulate appropriately, and making sure that they're doing it throughout their day so that they can have as much success and focus as possible. All right, so on to our next sense, visual. So this can be alerting. So when we think of alerting, we think of bright colors, lights, moving visual stimuli. And then when we think of calming, we think of dark colors, predictable rhythmic patterns, dim lights, blue-green shades, and the stimulus remains constant. Next, we have auditory. Alerting is going to be unexpected, loud, complex, or mixed or pronounced, and calming is going to kind of be an expected, quiet, gentle rhythm, or a simple melodic tone. A lot of times, I would say one of the biggest recommendations I give for people is the noise canceling headphones, especially if you're going to be going into a crowded environment, things like that. They've even come up, they have awesome, like you don't have to think about the big, heavy headphones anymore. I've recommended them to a few people recently. They're called Loop, and it's a very low profile earplug that it doesn't completely block things out, but it dampers down. And I had one of my patients who, she's 31 and she works in an office setting. She said it was perfect because what it did was it just canceled out all that filter noise, and enabled her to focus a little bit better, and at the same time calm down her anxiety while she was at work. So just simple things that you can kind of add to a person's day in order to kind of help regulate them better and allow them to be more successful. Smell and taste. So most odors tend to be alerting, but there's more. You can think of like familiar odors that can be associated with pleasurable and comforting experiences that might allow a person to calm down. So a lot of times, like in my office, I always have lavender. I always have orange. So lavender is going to be more calming, whereas orange and citrusy type scents are going to be more alerting. There was a huge, like aromatherapy, there's limited evidence. The only thing that I've really been able to find is that lavender does calm people. I know a few years ago, there was the whole essential oils thing, the Young Living kind of swept through, and I jumped on that bandwagon too. So trust me, they took a lot of my money. I still use them today. But usually when people ask about essential oils, I always tell them to make sure that the individual does not have any allergies to any of these oils. And to kind of just using them knowing that, hey, it might work, it might help the person, it might not. Just kind of up to the preference of the person. So typically when we think of like a sensory gym in the pediatric world, this is kind of what we're looking at. We have our trampolines, we have our swings, we have our crash pads, our mats, a lot of our gross motor equipment and things like that. But everyday sensory integration, you can kind of embed it into your own routine. It doesn't always have to look like this sensory gym. So you can have a mini trampoline at home. You can have someone carry groceries or help move furniture, or vacuum. That's heavy work. You can add some relaxing aromatherapy with a calming bath with lavender bath salts. You can do exercise. You can have a crunchy snack. You can incorporate things into a nighttime routine, use weighted blankets, and having calming colors in your bedroom. So when we think of sensory, it doesn't always have to be kind of what we imagine in the therapy gym. There's ways of embedding it throughout the day, whether it be at home, at school, or at work. So what about adults with sensory processing difficulties? So many of our clients may have received therapies as a child to address their sensory processing disorder or sensory difficulties. Pediatric therapies are often administered in a developmental model or an academic model. So meaning developmentally in pediatrics, a lot of times an individual will be seen for a long time. You're not just going to be going for a couple of weeks. When you're in therapy, you're in for months or years. Once you get into school, you start using the academic model, meaning that they'll be getting services throughout the school year, but a lot of it is based towards academic goals, meaning that what the child is working on in school-based therapy has to directly tie to school goals. But what happens when these individuals turn 18 or 21? We've been referring to this as like the service cliff, and that's kind of what led us to develop the Bridges program at Good Shepherd. Is, like I said, just because someone graduates high school doesn't mean magically all the support systems that you had in place to make that person successful, they still need them. It doesn't mean that they disappear. So we wanted to be able to have a place for people to come and still continue to have things addressed that they were getting addressed in school or when they were a kid, to make sure that it follows them throughout the lifespan. So someone who may have had a sensory diet in place in school or in therapy, it doesn't mean it goes away. You can kind of carry it into adulthood. A lot of times though, what we try to do, and again, it depends on the person and the family and what the needs are, we kind of look at what that person might have done as a child and kind of how might it be more appropriate as an adult. So am I going to take my 35-year-old patient and wrap them up in a blanket and put a mat over top and call it burrito? Sometimes I do, but it might be a little different in looking at wearing like a compression vest or getting, I have a few patients that actually, they sell weighted vests that you can just put on underneath of a coat or something like that, so that they're still getting that deep pressure and deep hug, but it's not like it's more of an adult appropriate manner. Same way too, I know for different people who might have oral motor, like proprioceptive cravings for input where they want to chew on things. Do I have the person continue to use those chewies that they have when they're a kid? Sometimes, if that is what works and you're comfortable with it and it allows someone to be successful, go for it. But all right, if we're thinking about what the input is and that person's getting out of that tool, are they safe to chew gum? They can chew gum. They can have a crunchy snack. You can have carrot sticks or pretzels or something like that, so that they're still getting that proprioception, but it might be in a way that's a little bit more appropriate. The other thing to think about too is that after you finish school, I mean, families and clients fall into new routines and patterns. So sensory can change too. What might work for someone at some point in time as they get older, they might that sensory need might be integrated and they no longer need it, or they might have new needs. And the patterns and routines you used to have when you're in school might change, and you might have to reevaluate when might be a good time to incorporate some sensory things in order to keep someone sensory regulated throughout the day. Here I listed some common signs of sensory processing disorder in adults. So they might be oversensitive to environmental stimulation. They don't like to be touched. I avoid visually stimulating environments, and I am sensitive to sound. I often feel lethargic and slow in starting my day. I often begin new tasks simultaneously and leave many of them uncompleted. I use an inappropriate amount of force when handling objects. I often bump into things or develop bruises that I can't recall. I have difficulty learning new motor tasks or sequencing step of a task. I need physical activities to help me maintain my focus throughout the day. I have difficulty staying focused at work and in meetings. I misinterpret questions and requests requiring more clarification than usual. I have difficulty reading, especially aloud. My speech lacks fluency. I stumble over words. I must read social material several times to absorb the content. I have trouble forming thoughts and ideas in oral presentations. And I have trouble thinking up ideas for essays or written tasks at school. But everybody is different. Like I've said, neurotypical individuals may have even sensory processing difficulties. I know when I was a student in school, one of the first things they had us do when we were learning how to evaluate and interpret sensory processing, we actually took the sensory profile. I am sensory seeking and sometimes low registration. The getting a slow start to the day kind of resonates with me. So I get that. So I think it's important when we think about sensory to also think of ourselves and kind of what we do in our days to help us regulate our sensory needs. The sensory profile, which I've mentioned a couple times, and I have this more curtailed to the adult population just because that's kind of what I do, but I do have experience a little bit in pediatrics too, so I can say that the adult sensory profile, they have a pediatric model as well as an adolescent and adult. And again, it's just a tool. I have gone into evaluations being like, oh, this person's gonna like go off the charts on this. I know how this is gonna come out, and it comes out completely different. So it's just kind of a way to begin to guide us to understand what a person's sensory needs might be. It's a self-questionnaire, and it can be filled out by the individual or by a consistent caregiver. And it's just a measure of sensory processing preferences. So the next thing I'm going to go into is sensory diet. And a lot of times when we talk about sensory processing disorder, this is a term that is thrown around a lot. And just to kind of explain what a sensory diet is, it's a group of activities that are specifically scheduled into an individual's day to assist with attention, arousal, and adaptive responses. These activities are chosen for the individual's needs based on sensory integration theory. So I'm going to show you another video.
It's not like there's a certain threshold or amount, or it's constant. The need for regulation, the need for sensory input to regulate is constant. There's no like, okay, I did it and I'm done. So I mean, I will have to do this as long as I'm sitting here talking. As long as the camera's on, I'm sitting here talking, I'm gonna have to do this. And then probably when I'm done with this, I'm gonna have to do something else because I'm gonna be dysregulated from this all day long. The concept of a sensory diet, I think, is good for balancing us. Like, it's good to promote balance or better regulation. But I also don't think it's not like it's going to fix it and then we aren't going to need sensory input later, or we aren't going to be dysregulated next week or next year or in 10 years. In the same way that if you stopped eating, like, you can't say, well, okay, eat a healthy diet this week and then you'll be all set. Like, it doesn't work like that. If you want to be healthy, you need to eat a healthy diet for the rest of your life. And so a sensory diet, or stimming, or sensory input, or promoting self-regulation is the same case. It's an ongoing, permanent thing. And so having like a prescribed diet and doing things on schedule is good, but it's not something that's going to be like done a year from now or 2 years from now or whatever. It's forever. And so for me, I think of more as like, I have a sensory landscape, because diet sounds a little bit planned and restrictive. And that landscape is constantly changing. It changes based on the seasons, based on what I'm doing in my life, based on how much stress I have. It changes from day to day or week to week or month to month. And it's a mix of very instinctive changes and sometimes very deliberate changes, because I need to really increase a certain kind of input on purpose to manage myself better. So I like the concept of just knowing what our sensory landscape is and then managing it both intuitively and purposely.
I like that video because she has
the
a really
best morning routine.
good way of explaining it, just to kind of from her point of view, because things change, and like she said, it's ongoing. It's not something that's necessarily going to go away. And that's when we're focusing on sensory in the adult population. If an individual has been having issues their whole life with the same sensory needs, it's therapy isn't going to make it go away. Like, they're going to continue to need sensory input. It's not at 45, it's not integrating. It's how do we help you manage and get you through what you need to do so that you can participate the best in your life that you can. So a lot of times in the adult population, what we're looking at is what are the needs of the person? Where are things kind of breaking down? And then what tools can the person or their caregiver, their parent, their friend, whoever might be with them, implement in order to maximize their independence and participation. So by providing the right amount of sensory input, we can prevent maladaptive sensory seeking avoidant behaviors to help our clients feel more regulated. So the big thing is kind of being intuitive to the person's needs and almost starting to see like sorry, my son's obsessed with Spider-Man, so Spidey sense is the first thing that comes to mind, but like kind of having that Spidey sense of like, oh, they're starting to go downhill. What can I implement before like the explosion happens? So you want to intervene with someone before they kind of get to that escalation stage. So you want to make a lot of little adjustments throughout the day, again, just to kind of make sure if you know this person needs deep pressure throughout the day, don't just like give it to them in bouts so that they're constantly getting what they need so that they don't feel anxious and kind of have maybe their schedule changed. And if they're regulated, you might have like a minor, but like if they're dysregulated and their schedule changed, like that's kind of when you're starting to get into some possible explosive behaviors or meltdowns or things like that that can really throw that person off their day. A lot of times, like if we're at work, we may leave our desk and go walk when we feel fidgety or put on headphones to block out external noise when we're trying to concentrate on activity. That's us regulating our sensory needs. But these individuals might not know how to be able to, they might not know or they have or have not been engaging in maladaptive behaviors to try to regulate themselves. So we need to be able to provide opportunities for appropriate sensory input. And a sensory diet can provide the needed input that someone may crave throughout their day to stay regulated. A sensory diet may be used on a routine basis, meaning that it's embedded into somebody's schedule or as an as needed basis. I have one individual that I've worked with for a long time, and he has certain activities that his staff does with him every day, but then he has extra things that like if he's going to a doctor's appointment, he typically does not like going to the doctors. They have tools they use while they're going there, while they're in the visit, and when they leave to keep him regulated so that he doesn't get too anxious. So you can kind of use things too as an as-need basis based on what that person might be going through on that particular day. So OTs can assess an individual's sensory processing skills to develop an appropriate sensory diet to allow for successful engagement in daily activities. OTs will use their expertise in activity analysis, meaning it's kind of how we look at activities, break them down, and be able to modify, adapt, or restore function and independence with daily activities. A sensory diet is customized to an individual's sensory preferences needs to be initially administered with close monitoring for overstimulation or too much input, which might put a patient over the edge. And you should consider the environment, who, where, and when this person might be utilizing some of the sensory diet. I included a slide with different resources for sensory processing disorder. So a few of these are books that I have read. The Out of Sync Child, and there's also one for an adult version, so the Out of Sync Child Grows Up. Sensational Kids, Unmasking Autism, Discovering the New Faces of Neurodiversity. And I put into links, I don't know if this presentation is going to be sent out afterwards or not. I can always include those links separately if anybody would like them, but it's a resource and parent and professional page for the STAR Institute. And they're kind of the groundbreakers in sensory integration. I believe they're out in Colorado, but they're kind of like the most well-known like OT hub for sensory. And then there's a sensory processing disorder parent support website that I found too that had some useful links as well. I wanted to briefly go over the Good Shepherd Adult Developmental Disorder Program. And I've kind of highlighted a little bit throughout the presentation, but we do have an outpatient therapy program, which is designed to bridge the gap between pediatric services and adult services. We accept most insurances, and it would be billed under an individual's medical insurance based on what their insurance benefit provides. It allows individuals with developmental disorders to be evaluated and receive a multidisciplinary therapy approach through OT, speech therapy, physical therapy, physiatry, and care management. And like I've said, just because a person ages out of school does not mean that their functional deficits have disappeared. So we look to address skilled therapy needs throughout the lifespan, and we use what's called an episodic model. So I had mentioned the developmental and the educational model earlier. So in the adult world, it's a little different than pediatrics. We usually see people in episodes of care, meaning we might see an individual for a few sessions, or we might see them for 12 weeks or 4 months, and then we'll discharge the person, but we'll give them and their family like a home exercise program. So things that they continue to work on at home. And then depending on the person's needs, we always do a follow-up call within 6 months. And we always like to, if the person feels they need to return to therapy to continue to work on things, we bring them back for another episode of care. But we would at least like to be able to check in with people on a yearly basis just to make sure that all of their needs are continuing to be met. If a person has sensory needs and they are in the school setting currently, sensory needs can be addressed through an IEP. It just needs to be demonstrated by the occupational therapist and probably the student's main teacher that the sensory behaviors that they're noticing is impeding on the student's ability to engage in school tasks. So it always has to be tied back to school. If the individual is already receiving occupational therapy through the school, you can always mention it with their OT. If they have not been evaluated for services yet, I believe that typically goes through either their main teacher or the school guidance counselor to try to initiate getting the individual evaluated for school services. And that's where I'll open it up for questions if anybody has any questions.
Great. Thank you so much, Allison, for presenting this evening. We are so thankful for this presentation. There were so many great examples and some of those videos were spot on. So thank you again for your time this evening.